Proactive scoliosis care: how to outsmart curve progression before it starts, using genetic insights, nutrient therapy, and early intervention to prevent a child's small curve from becoming a big problem. For decades, scoliosis care has been defined by a frustrating phrase: wait and see. A child receives a diagnosis of a small spinal curve, the doctor notes the degree of curvature, and the family is told to come back in 6 months for another X-ray. Nothing happens in the meantime except anxiety, uncertainty, and the silent progression of a condition that is far more complex than it first appears. This traditional approach assumes that scoliosis can only be treated after it worsens. But in reality, that watchful waiting period is when the most valuable window for prevention quietly slips away. Modern science now offers a better way, one that replaces passive observation with proactive, evidence-based intervention. Rethinking scoliosis prevention requires recognizing that this is not simply a spine problem. The curve in the spine is the visible symptom of an invisible imbalance occurring throughout the body's neuro-musculoskeletal system. In other words, the brain, nerves, muscles, bones, and even the body's chemistry all play a role in whether a child's spine stays straight or begins to twist. Traditional orthopedics has focused on bracing or surgery to force the spine into alignment, but these approaches do little to correct the underlying reasons why scoliosis develops and progresses in the first place. When viewed through the lens of modern genetics, nutrition science, and neuromuscular research, scoliosis begins to look less like a random orthopedic problem and more like a condition that can be predicted, influenced, and even prevented. The goal of proactive scoliosis care is not just to monitor the curve, but to understand and influence the biological factors that drive it. This approach is built on 3 interconnected steps: identify genetic risk, optimize metabolism through targeted nutrient therapy, and intervene early with neuromuscular retraining. Together, these steps represent a powerful model for outsmarting scoliosis before it spirals out of control. Step 1. Identify risk: genetic testing and the hidden blueprint of scoliosis. In the past, families were told scoliosis just happens. While the exact cause of adolescent idiopathic scoliosis, AIS, remains complex, scientists now know that a specific pattern of genetic variants can dramatically increase the likelihood of curve development and progression. These are not disease mutations, but rather subtle differences in DNA, called functional polymorphisms, that affect how the body processes neurotransmitters, hormones, and nutrients essential for proper muscle and bone function. For example, genes such as MTHFR, COMT, and VDR influence how the body uses folate, breaks down dopamine, and responds to vitamin D. Variations in these genes can alter neurochemical balance, muscle tone, and bone density, 3 factors deeply tied to scoliosis behavior. Research from programs like Curve IQ, developed by ScoliSmart clinicians, has shown that children who test positive for multiple scoliosis-related variants are significantly more likely to experience curve progression than those who do not. Genetic testing transforms guesswork into guidance. Instead of waiting to see if a small curve worsens, clinicians can now identify children who are genetically predisposed to progression and intervene long before the spinal deformity becomes severe. This knowledge also empowers families. Understanding a child's unique genetic profile helps parents move beyond fear and toward a proactive plan rooted in science, not speculation. Just as cardiologists use cholesterol markers to predict heart disease, scoliosis specialists can now use genetic markers to identify high-risk patients early. This shift is critical because it changes the entire timeline of care. Instead of reacting after a curve has worsened past 25 degrees, genetic insight makes it possible to act when the curve is still mild and most responsive to intervention. In other words, genetic testing opens the door to true prevention. Step 2. Optimize metabolism: nutrient therapy and the biochemical balance behind the spine. Once a child's genetic risks are identified, the next step is to optimize metabolism through nutrient therapy. This is not a vague recommendation to eat healthy, but a targeted, data-driven strategy to support the body's natural ability to maintain spinal alignment and postural control. Every muscle contraction, bone remodeling process, and nerve signal depends on an intricate web of biochemical reactions. When even one component, such as a vitamin, mineral, or neurotransmitter, is out of balance, the effects ripple throughout the entire musculoskeletal system. In scoliosis, certain patterns of imbalance appear again and again. Low serotonin, high norepinephrine, elevated histamine, and hormonal irregularities such as a low progesterone to estradiol ratio. These imbalances can amplify stress on the postural control system, making it harder for the brain and spine to communicate effectively. Nutrient therapy aims to correct these imbalances using precise supplementation based on genetic and metabolic testing. For example, a child with an MTHFR variant may require methylated forms of folate and B12 to properly support neurotransmitter synthesis. Another with a COMT variant might need magnesium and SAMe to regulate dopamine and norepinephrine activity. Similarly, adequate vitamin D and calcium are essential for bone density, while omega-3 fatty acids support nerve health and inflammation control. This targeted biochemical support helps the body function more efficiently at every level. Muscles respond better to exercise, nerves communicate more clearly with the spinal stabilizers, and the hormonal environment becomes more favorable to bone strength. Over time, these metabolic improvements create a foundation that reduces the likelihood of rapid curve progression. It's important to emphasize that nutrient therapy is not an alternative medicine gimmick. It's precision medicine applied to musculoskeletal health. Each supplement recommendation is grounded in lab results, not guesswork. By treating the underlying metabolic weaknesses revealed through testing, clinicians can help the body correct the subtle physiological triggers that traditional care ignores. In this sense, nutrient therapy acts like software maintenance for the body's operating system. When biochemical pathways run smoothly, the body can devote more resources to growth, repair, and balance, key elements in stabilizing scoliosis. Combined with genetic insight, it provides a personalized roadmap for supporting a child's unique biology, transforming scoliosis care from reactive to preventative. Step 3. Intervene early. Neuromuscular retraining and the power of movement. The final pillar of proactive scoliosis care is early physical intervention, designed to retrain how the body controls posture and movement. Traditional physical therapy often focuses on stretching or strengthening isolated muscles, but scoliosis involves a much deeper issue: neuromuscular coordination. The brain and body must constantly communicate to keep the spine balanced, especially during growth spurts. When this communication breaks down, the spine begins to twist as muscles fire unevenly from side to side. Programs such as the ScoliSmart Small Curve Camp are specifically designed to address this neurological imbalance. Using a combination of posture-specific exercises, balance training, and advanced tools like the ScoliSmart Activity Suit, children learn to reprogram their brain-to-spine connection. The Activity Suit gently activates muscle patterns that promote symmetry and postural stability during everyday movements like walking or running. This form of neuromuscular retraining is not about forcing the spine straight. It's about teaching the body how to hold itself correctly again. The earlier this process begins, the more adaptable the brain's motor patterns are, and the greater the potential for curve stabilization or even reduction. Early intervention also reduces the emotional toll of scoliosis by giving children an active role in their treatment, building confidence and self-awareness along with physical strength. What makes early neuromuscular intervention especially powerful is how it synergizes with the other two steps of proactive care. When nutrient therapy has optimized neurotransmitter balance and genetic insights have identified at-risk patients, the body becomes far more responsive to movement-based training. Muscles coordinate better, endurance improves, and the nervous system learns faster. This integrated approach addresses scoliosis from the inside out, biochemically, neurologically, and physically. In contrast, the traditional wait-and-see approach misses this critical developmental window. By the time curves reach the bracing or surgical threshold, the neuromuscular system has already adapted to an imbalanced posture, making correction far more difficult. Early retraining prevents those maladaptive patterns from becoming permanent. Breaking the cycle of wait and see. To truly outsmart scoliosis, the medical community must move beyond the outdated cycle of surveillance and delayed action. The wait-and-see philosophy is built on the assumption that nothing can be done until the curve gets worse, a belief that modern science has proven false. By the time a child's curve progresses beyond 25 to 30 degrees, the biological and neurological factors driving it have already been active for years. Waiting only allows those processes to strengthen their hold. Proactive scoliosis care flips that script. It gives clinicians and families the tools to intervene at the earliest and most effective stage. Genetic testing identifies which children are at risk, nutrient therapy corrects the metabolic imbalances that feed progression, and neuromuscular retraining teaches the brain and body to cooperate more effectively. The combined effect is a measurable reduction in both curve magnitude and progression risk, turning what was once a chronic, unpredictable condition into a manageable, preventable one. This approach also reflects a broader shift in medicine, from reaction to prevention. Just as we now screen for heart disease, diabetes, and certain cancers before symptoms appear, scoliosis deserves the same proactive attention. The technology exists, the research supports it, and the ethical imperative is clear. If we can prevent a child's small curve from becoming a lifelong problem, we should.